Imagine living without a heart. Think about how it would feel. It's impossible because it's a necessity for life. Today, our team was tasked with choosing between 5 potential candidates for a heart transplant surgery. Good morning. My name is Jake Norman.
I'm Fabian Mayo.
I'm Valeria Luciano.
And I'm Fernando Streams. And this are heart transplant recipient criteria.
So, who did we choose? We chose candidate A. Candidate A is a 41-year-old woman. She is a recovering alcoholic and has been sober for 14 months. She recently became a widow. She has a 6-year-old daughter and she has a job waiting for her post-operation. So, we chose her due to the following criteria: employment and finances, morals, family, and post-procedure.
So, our first criteria was employment and finances. Employment and finances in this case is considering how the procedure will get paid and also how our patient will be financially afterwards. So, as many of you know, a heart transplantation is not a cheap procedure whatsoever. In fact, in 2020, the average cost was 1.6 million US dollars. Now, some of you might be wondering, how is patient A going to be able to afford such an expensive procedure? And the answer is that technically, she won't have to. Patient A has insurance, which covers majority of the cost for a heart transplantation. Also, in the article, Returning to Work After Heart Transplantation, a 12-year follow-up, it talks about how older recipients are less successful in finding jobs. Thankfully though, patient A has a stable job waiting for her after her recovery, meaning that she will be able to take care of both her family and herself.
Okay, our second criteria is morals. In this case, morals is referring to the lifestyle of the patient and her beliefs. So candidate A, like previously stated, is a recovering alcoholic who has been sober for 14 months. It was said that she wants to continue the sobriety. She also wants to be able to raise her child. Right now, her child is in the care of her grandmother, and her grandmother probably won't be able to support for her like a mother would. So she wants to be able to raise her own kid. Both of these reasons show that she is a good and moral person, and she is responsible and willing to put in the work that's needed to better her life after the surgery. Since she is a recovering alcoholic, a new heart will benefit her. According to the proportionally fair organ transplant allocation, medical urgency is perhaps the major criterion that UNOS has followed for organ allocation and intends to prioritize the sickest patient. She's an alcoholic trying to recover, and according to UNOS, this would probably put her at the top of the list to getting a transplant.
Our third criteria is family. So she has a 6-year-old daughter, which will allow, and the surgery will allow her to grow up or raise her daughter after the surgery. Since her daughter was recently living with her grandmother, and the surgery will help her raise her afterwards.
We believe that it was really important that this mother be reunited with her daughter. Throughout her struggles as an alcoholic, we believe that giving her a second chance is important.
Considering the future of cardiac transplants, candidate A has a good future. Researchers have been looking for ways to make sure patients don't reject the heart after and before the surgery, and so that the heart is a good match for the patient. AI is one of these ways that researchers have been looking into. Artificial intelligence is starting to be used in transplant pathology. The life expectancy after the heart transplant is about 11 years, so AI making sure there are no signs of rejection before and after the surgery would help make sure that candidate A can live throughout those 11 years. Trial and error. So in this table taken from Artificial Intelligence Advances in Transplant Pathology, which is an article where researchers, labs, and doctors all collaborated to see the impacts of AI on transplant pathology, we see different AI models and the data sets that they took and the performance that they had. And for example, the GAN, an AI model, took 12 non-rejection and 12 rejection slides. And throughout those slides, it was able to detect about 96% of the rejection slides, meaning that if you use this on a real patient, 96% of the time, AI will be able to detect any signs of rejection.
Okay, why not these candidates? So candidate A is on the older side, meaning that he will most likely struggle to find a job afterwards. Also, he has had other medical complications already. Candidate C smokes and drinks regularly, so that might interrupt her procedure, and she has no time for family due to working out and work. Candidate D, while he's the good choice, he seemed like the basic choice, and we realized that candidate A had more to lose, meaning that, for example, if candidate B didn't get the procedure, his 3 daughters will still have a caretaker. But if candidate A didn't have the procedure, her daughter will be left all alone. And candidate E, sadly, she has no health insurance, no family, and has no housing. So it's really unlikely that she will be able to afford it. Sorry.
Thank you guys.